Welcome to Sit and Stay, the podcast that breaks down the challenges of starting and maintaining a mental health practice into digestible chapters. Sit and Stay is presented by RipsyTech, an electronic health record company committed to addressing the mental health crisis in the United States.
Hello and welcome back to the Sit and Stay podcast, brought to you by RipsyTech. I am RipsyTech product manager Parker Anderson, and as always, I am joined by RipsyTech founder and CEO Tom Tarshis. Hey, Tom.
Happy holidays, Parker.
Happy holidays. You said it before I got a chance to say it. Thank you. So before we dive into this week's episode, some very quick updates. I've been doing these for the last few episodes, and I'm going to keep doing it until further notice. So we recently started a How to Start a Private Practice course, from the idea of having a private practice all the way to a registered business. Go check it out at ripsytech.com/practice if you haven't already. We've already gotten a lot of great feedback from people on it, and we're just excited to provide that resource. So please go check it out. Okay, Tom, we have a topic that you presented to me the other day that I was actually quite surprised we hadn't covered before, which was the decision to choose nonprofit status as a mental health practice versus a for-profit status. So let's just dive into it. At a practical level, what's the real difference between running a nonprofit clinic versus a for-profit one?
Yeah, and I think we've in other podcasts, there's been little snippets about it, or in the private practice course you mentioned it, talk about it a little bit as well. And I think it's been on my mind as our nonprofit is regrowing and end of the year comes up, and it is an option also that there are lots of people in solo practices that decide to be a nonprofit. And even people who do solo cash practices can be a nonprofit. And so, on one level, you sort of decide your business structure as a C corporation, S corporation, sole proprietor. What can you do as a practitioner in your state? But as an option for most states, if you do become a C corporation, is that you can then decide, are you going to be for-profit or nonprofit? Parker, when someone says, hey, I run a nonprofit, what pops into your mind as word association? What are the first 5 words that pop into your mind?
I don't make much money.
Wow. Fair.
That's my bad. Maybe a contentious thing to say.
That is valid. I think what I would mean maybe is, more from like, oh, it's a nonprofit business. That means, and so maybe lower salaries, maybe. Very business minded of you. But what else?
Yeah. Well, I mean, okay. That was the financial side. I mean, from like a moral standpoint, I would think like, I have a strong moral compass. Like, I believe, I don't know. When somebody tells me they do nonprofit work, I kind of see that as like, they're like morally, they're thinking in a morally just, how can I make the world a better place type of like mental framework.
Okay. All right, good. And what else do you associate with nonprofit status?
Oh, goodness. Community, helping people,
Okay.
and volunteers.
Okay, good.
People working, people able to like legally work without getting financially compensated. That's kind of it.
Well, what else on the volunteer piece? Anything else, especially around this time of year? A lot of
charity,
giving
back,
and then
donations.
Donations, right? People can give money to your company and take a tax break.
That's true. Yeah.
Now, Parker, can any business be a nonprofit? So, Parker's superhero anime AI
Jeez.
art
Oh, jeez.
design internet company. Can you be a nonprofit?
Interesting. um, I don't know. I would never start that company. Let me start there. But if I did, yeah, no, I don't actually. I don't know. I mean, that to me sounds like something that could be done as like a 1099 without even registering a business. Um, unless you make a certain amount of money. But I like to me the idea of that being a nonprofit doesn't make a ton of sense because I don't really know who I'm giving back to other than myself.
Gotcha, gotcha. Yeah, no, so there are sort of categories that you have to meet in order to be allowed to even apply for a nonprofit status. Um,
Okay.
one, scientific entities, public safety, literacy, education, hospitals, clinics, churches. There can be nonprofit political organizations and other private foundations, but there has to be some piece of public good or some theme there in order for the IRS to even consider giving you nonprofit status. One of the, I'll say, I know I've referenced this before, but when I was business naive, I just and created the company back when I was still finishing my training in medicine. I just thought, nonprofit equals good, for profit equals evil, which is definitely not the case. It is your mission statement and what you do in business. So I sort of blindly just pushed ahead to become a nonprofit, which ultimately I think has been a good experience and knowledgeable. Um, but if we're looking from a business structure, and so anyone who's opening a mental health clinic or is even in private practice, because you are providing a service and it is treatment, you are eligible to apply for nonprofit status. From a practical standpoint, if a business is nonprofit, you do not have to pay any taxes to the government on what, Parker?
Oh gosh. Yeah. I don't know. I'm coming at this completely blank slate. I haven't done a lot of time in investing the knowledge on this. I don't know. On the income.
Yeah, so you got it right, and it's not like you're supposed to do research, but that's what makes you a good host. And I'm going to assume most of our
Guinea
listeners
pig
are
host.
not experts either, so it helps
Yes.
me
Yeah.
frame where to go with the discussion. But yeah,
Voice of
so
the audience.
at the end of the year, when you're looking at your profit and loss statement, if your practice or is going to be $50,000 profit, you would have to pay state and federal taxes as a business. So it's the lower tax rates, but you are still taxed on profits as a business. However, if you're a
Right.
nonprofit, you do not have to pay those state and federal taxes.
Okay, but as a nonprofit, where does that profit go?
The profit just needs to go back into the business for
I
expanding
see.
services. And now, as a small group or even as a private practice, you can make it so that the business actually is break even by just paying yourself in salary, or spending the money and making sure there is not leftover profit in the business. And then
Hmm.
by virtue of that, you don't pay taxes on profit either. And in general, if you're in, you know, solo practice, you have that. That's maybe another podcast topic around, do you pay yourself and make your business come out even, and the pros and cons of paying money to yourself and then paying, personal taxes on it versus leaving some in the business, paying the business taxes.
Hmm.
That's a whole other accounting topic. Um, yeah, but
Okay.
that Go ahead.
Okay. No, I was just thinking, I mean, like, where is the, I guess, morally gray line of, like, how much you're deciding to pay yourself?
Good question. And I, that real quick to finish up the other topic. In
Sure.
general, the reason to leave to be profitable and show that your business made a profit is if you're planning for growth or bringing in other investors, or you have other business plans and you want to show that you're running a business that's more and more profitable each year. If you just have your business structure set up to pay yourself as a clinician, there's not much reason to actually show a increasing profit year over year. You just pay yourself higher salary. It makes more sense.
Okay, so then who who is a nonprofit structure like a good fit for? And like why would I guess if I was the solo provider, like why would I what should my frame of mind be, or what should my conditions of life be? Like why what would make it a good fit for me versus not choosing it?
Yeah. So going back to your question on how much can you pay yourself, so there you can pay yourself what other professionals with your degree in a similar practice make. So to your first statement that nonprofit equals giving, not making much money, that
Well,
is
it's just the word association, nonprofit, right?
right. So for example, um, when I initially started my nonprofit, just sort of giving you data to support your comment, I didn't really pay myself for the first many years, but I was a little business naive, and um,
Mm.
we're working to get things rolling and made some mistakes there, and was fortunate to be able to not have a salary. But then when things were going well, and I'm like, okay, here's my salary, you do need to justify, if you're paying yourself, and right, I was, making, sim all the you know positions in the company sort of had the same salary scale, and I don't remember exactly what it was at the time, but if it was $200,000, I would need to be able to say, yeah, I'm making $200,000 as the director of this nonprofit, but other physicians in my group make the same. I have these credentials. This is the average salary for a physician administrator in the San Francisco Bay Area. So it's very easy to justify your salary. I think eyes do get raised that, like, if you are running a nonprofit, just distributing. I've been at some meetings where sort of, someone was collecting donations to send coats overseas and paying themselves $470,000 a year. That was, they were like, the IRS will be knocking on this person's door soon. Um, but so you do need to
Interesting.
um, be able to justify a salary you pay yourself. That being said, any
Okay.
clinician in your area, you could find other uh, clinicians of your level that are, certainly making a wide range of salaries. So, if you were a master's level provider, and somehow had a way to pay yourself $700,000 a year, that might be hard to find other master's level clinicians actually earning that. But you could easily pay yourself $200,000 probably as the director of your solo nonprofit, and find other people that make that, and that salary would be okay.
Yeah, I guess like when it comes to being a mental health clinician, or really just like any healthcare clinician, there are people who don't take insurance and probably make a little bit more, and then there's people that do. So I guess I'm wondering. I mean, at the end of the day, like this is how much money can you even manage to make on your own in your nonprofit to where you would be paying yourself more? But I guess I don't know, maybe let's say I have 5 employees and they all work full time and I pay them a little bit less than what they bring in, but then I pay myself like $400,000. But hey, Joe Schmo living in XYZ place, he doesn't take insurance and he makes $400,000. Like, could I justify that?
Yeah, you potentially could. I think, the one piece for clinics to get the nonprofit status is either you need to enroll with Medicaid, so you need to be a provider of services for the Medicaid program, or you need to show that you are giving away at least 10% of your services for free. So either, and you can do that different ways. You can show fully free services or very generous, 50% off sort of charitable discounts. So there is, even being a nonprofit doesn't mean you have to take Medicaid, but you do need to show that how much charitable revenue your company is donating each year. So like back to your, who's the structure a good fit for? So you can pay yourself a reasonable and appropriate salary if you're going to be working with Medicaid, or as we've talked about before, if you're going to be pretty generous in giving away services, like especially people doing a cash practice who, don't want to deal with insurances, but are going to then do, right? So 10%, if you're going to do a half day free a week, there's your 10% that you're giving away, and that would justify your nonprofit status. And then the nonprofit status does open you up to things like being eligible for donations. It does open you up for a few more grants that you can apply to. That being said, a lot of grants and other have now go to both nonprofits and for-profits. So there are still lots of grants out there, even if you're set up as a for-profit. But if you see yourself doing, looking to try to get a lot of donations or specific grants that require nonprofit status, or, it can be something that is also a little bit of a market differentiator. So people in general have positive feelings about a nonprofit.
It's true.
It sort of sends even if it's a cash nonprofit, it sends a little bit of a different message, and letting people know what you're doing with, how you're giving away that 10% or helping the community. We are in a helping profession, and it is, a lot of people easily would qualify for the status. And so, yeah, it has that kind of marketing, doing good, extra stamp on it when you're, and that's appealing for some people to say, yeah, I started a nonprofit.
So, any other things that you think we should cover in terms of like how the money works for a nonprofit versus a for-profit?
Yeah, I mean, essentially, the budget, when our nonprofit flipped, when we pulled the clinical services out and made that a for-profit, the budget, everything stayed exactly the same, right? The and then so ultimately, if you're the for-profit and you have money left over at the end of the year, it's this decision about how much do you put back in the company, or do the owners each take some percentage of what they're entitled to as the owners, because
right.
And
They're the ones that take on the financial risk.
Yeah, and we were never a group to I never cut myself a check anytime the company was profitable. It was always back into the company or expanding services or driving the mission, right? So that's where it's a mission-driven piece, and your nonprofit or for-profit status doesn't matter too much about, the care you're delivering or the path you're going. I think the other thing I had mentioned before is, at the beginning, I didn't realize is very hard. Banks don't treat nonprofits as well as for-profits, because if the government guarantees loans through banks for-profit businesses through the Small Business Administration, but there is no such thing guarantees for nonprofits. So if you hope to get a line of credit or a loan just going through your business as a nonprofit, it is very difficult to do that if you're a smaller business or just starting out. And I had the very unpleasant experience of actually when the nonprofit was doing well, we did get a nice line of credit, which was great. And then, Parker, what do you use the line of credit for? Hey, well, let's open another site or hire more staff. That costs
Mm-hmm.
money. And then it takes
Mm-hmm.
time then to recover that. And, after the bank saw, after I took a line of credit, the bank came and they're like, well, wait, your profits are down. And it's like, well, yeah, because like we hired 5 new expensive clinicians, but they're ramping up. And they quickly said, nope, this is no longer a line of credit. It's a loan and you're going to collections. And I was like,
Oh.
awesome. And I tried to, I even angry Tom, I tried to reach out to the guy who had like helped set up the line of credit, like who had been, my kid has mental health issues. You guys are doing great, blah, 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 blah. And he wouldn't return my calls when I'm like,
Wow.
so that
Wow.
left a really bad taste in my mouth. I think it's a good lesson for as we're in V2 of the nonprofit growth. We have, I will make sure we're profitable every month and that we will fund our growth, without outside assistance and make sure that it is a bummer because it means you have to be more gradual with sort of hiring patterns and other things, but
Right.
not going to get trapped in that situation again.
So I want to kind of quickly go back to something you were talking about earlier. When it comes to for-profit versus nonprofit, and does it, if I want to like cut my employees a bonus at the end of the year for whatever, like is that more complicated to do in a nonprofit, or is that just totally okay?
It is totally okay, right? So you can still give employees a bonus. You could give yourself a bonus, right? You could still have whatever quarterly compensation bonus models based on RVUs. You can really do anything and run it exactly the same way. Um, I think
Gotcha.
yeah, there are differences around boards and things like that, which I think is a
That's what I was about to transition into. If we want to just go straight into it, because how does that work? Like who owns and runs the practice between a nonprofit and a for-profit? Who controls things? Is there a board on a nonprofit? Are there boards on every for-profit? How does that work? Who makes the decisions?
great questions. And yes, so and every states are a little bit different, but in general, um, there are different boards that are in charge of companies, right? And then connected with the boards are, how many directors do you need for a company? And so that, the directors is like, who's the CEO, who's the secretary, who's the treasurer, how many company officers do you need? And then those company officers are usually hired, by the board of directors. Most states, some it varies. And in California, I'm going between, do you need 3 people? Many
He's googling.
I'm Googling
The
kind of slow.
googling is happening.
Oh, you know what? I
Hmm.
was right. You only need one, right? So IRS and other people always
Interesting.
recommend 3, but technically you only need one director for a nonprofit. So you could be solo and you could be, right, the sole board member of the nonprofit. And then I think that you need to, um, yeah, and so it is kosher to do that. And I do know some people who have done that. The the main piece with a nonprofit is as your board grows, you need to a majority of the board members have to not be related or through blood or marriage. So You need to,
Right. Okay.
if you and your partner have started a nonprofit entity, um, and you both want to be on the board, then you need to pull in three other people who are not related to you.
Wow.
And now the thing about a nonprofit is you can be kicked out of the nonprofit that you started. I mean, this can happen in for-profits also, but there are ways to structure things in for-profits where you can make it so you can never be kicked out. Um, by saying that because there's ownership in the for-profit, and you can say put in rules
Oh, okay.
around the board
Right.
cannot kick. You need X votes, or you need a complete majority to make any changes to who's in charge, and thus they need your vote. So there are ways to protect yourself in a for-profit, but in a nonprofit you can't do that, right? This is a company for the community. So theoretically you could say, hey, I'm going to put my two good friends on the nonprofit because I know they'll help me run it. And then in 8 months they're like, we're tired of Tom's sarcasm and his soapbox speeches that are hurting our productivity. He's out of here, and that's it. You're right. So it is something to think about.
So okay, well, I mean, I guess from the for-profit stance, what I mean, does every company need a board? If I start an ice cream shop with my wife, like, do we need to have our own board?
Not if you're depending on the structure, right? So that depends. Are you going sole proprietor? You don't have a board as a sole proprietor, right?
I see. Okay, so it comes down to like the company type.
Correct.
Gotcha. 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 Okay. All right. Let's move on. If somebody is deciding right now if they want to start a mental health practice and they're thinking between nonprofit and for profit, what should they be asking themselves before they file anything?
Yeah. So what you essentially you want to make sure you choose a structure that is allowed to be a nonprofit. And ultimately, you do all the business stuff first and get your tax ID, and you get your the corporation set up, and then you have to apply to the IRS for your nonprofit status. And that process takes a while. And that's where you sort of put together what's the mission, why do you meet the qualifications to be a nonprofit, and then you send everything in and wait for the IRS to grant you the determination letter. I had and usually it's like 3 to 6 months. I knew someone who had recently applied, and I think it took about 6 months to get the nonprofit status. Um,
Mm,
yeah, so
yeah. Okay, that's right.
and the sometimes you hear in the news like, oh, they're gonna pull the nonprofit status from this company, etc. On some level, as a mental health clinic or as a practitioner, we always go over these worst case scenarios. It's if you lost your nonprofit status, unless you were getting huge donations or had a huge grant that required that, it's probably not going to be such an awful thing to happen to your clinic, right? You can still keep rolling. The only practical thing is that if you have profits, you then have to pay taxes on it. And if you were getting donations or grants that required nonprofit status, you would lose those. But most people who are going to be running a mental health clinic, your revenue generation is still going to be through direct services. So it is low risk. It's a little extra paperwork. It's a fun endeavor to do. I think it's cool to say that you started a nonprofit and that your practice is a nonprofit. Um, and yeah, so everyone should think about it
Yeah,
um, if any of that's
I like it.
appealing.
All right, Tom, we're coming close to the end. Do you have a mental health business moment for us this week?
You know, let's see. What's on my mind coming up? Let's do a pre. Let's do a well, and I don't. This episode will drop after the new year, actually. So,
It will. It will. It probably won't come out until late January.
so Parker, what's happening in the great state of California is.
Ah,
Oh,
that's right. I know this.
well, there's several things, but let me see what's on your mind.
There are several. Oh, I was gonna say there was something about credentialing
Ah,
and needing to get 90 days, or the let's see, was it? Oh gosh, it was like something about the if they take too long to approve your credentialing, then you can operate and just get like pre-approved or operate as if you're approved because they took too long administratively, something like that. I was writing a whole blog post about it last week, and it's a new week, so I was just like the info just fell out of my head.
yeah, no, that's true. The insurance companies have to credential new providers within 90 days, or you are assumed credentialed. So that is not what I was thinking of, but that is one of the several things happening in the new year. What I was thinking of is that, and we've talked about this also previously, that sometimes people's mental health goes through a mental health carve out through their insurance. And in the state of California,
Yep.
Blue Shield, a lot of Blue Shield members, their mental health was carved out to Magellan, which is a specific mental health
I've had
insurance
Magellan
company.
in the past. Yeah.
To be specific, I think it's around 1.8 million people in California were getting mental health services through Magellan, but that is ending December 31st. So those 1.8 million members will be needing to be serviced by Blue Shield in network providers. And I venture to say there are not enough providers to handle that.
Okay, wait a minute. Blue Shield was okay. People have Blue Shield, but then did Blue Shield have like mental health and network contracts that providers could sign up with?
Yeah, and in fact, our
Oh,
clinic is in network with Blue Shield.
okay. So then why were they carving out to Magellan for so many people?
Well, Parker, it goes back to this board. Parker, I don't know. Come on, like,
Okay. Well, because like, so when I had Magellan in the past, it was because I had Kaiser, and I had told Kaiser like, "Hey, I just want to see an outpatient therapist," and they're like, "Oh, like what's wrong with you? Like, what?" I was like, "No, like I just want to see an outpatient therapist. How can I do?" And like, I luckily I had a coworker at the time who had kind of told me like, "Oh yeah, I had Kaiser. This is what I did." Mention like carving out to somebody else, and I was like, oh, okay. It's like I had to know that and say that to Kaiser for them to be like, oh yeah, we can carve you out, and they carved me out to Magellan. So then I found a provider who's in network with Magellan. So I imagine, okay, so then if there are people who have Blue Shield and their mental health benefits have been carved out to Magellan, they might be seeing a therapist who's in network with Magellan but is not in network with Blue Shield, and that's the transition
yeah, so
that's happening.
that is the issue, right? Um, that there are people who are going to not be able to continue with their current providers, and you know, we'll see how it goes. So let's
Yeah,
it's
yeah,
like
yeah, yeah, yeah.
like a pre mental health business moment. We'll see what happens via our appointment requests for new Blue Shield members, and I will update
Yeah.
us.
Gotcha. I mean, another pre-business moment. I mean, just something that happens every year is everybody's insurance benefits kind of
We
hit
are
the reset
getting
button.
ready to blast out an email and a link for people to update their insurance, which still doesn't capture everyone, but and
Right.
those deductibles reset. So those visits that
Right.
have been covered or only a low co-insurance, all of a sudden, um, yeah. So it is we are do the best we can to prep people and remind them, but there's always unhappy clients because of our broken mental health care system.
Yeah. Yikes. Okay. Well, yeah. Keep us posted. That would be interesting. all of that, I think, will be interesting to see how it shakes out. Okay, I think that's a perfect place to wrap things up. Thank you for tuning in to this week's episode of the Sit and Stay podcast, brought to you by RipsyTech. If you enjoyed the episode, we would really appreciate you leaving a rating or review on whatever platform you are listening on. And if you want to get in touch, please email us at sitandstay@ripsytech.com. And don't forget to go to ripsytech.com/practice and check out that How to Start a Private Practice course. We're very proud of it, and it's just a very good resource. All right, Tom, I will see you next time.
Thank you, Parker.
And happy holidays.
Happy holidays.
Or, happy late January.
Right. Bye.
Bye.
Thank you for tuning in to this week's episode of the Sit and Stay podcast. Until we meet again, we invite you to sit and stay with the ideas and stories shared today. Dive deeper into how RipsyTech can support your practice by visiting us at RipsyTech.com.